Hi, Mrs. Broomhead. We're H for Health and we'll be looking after you today. First of all, we'd like to know what your priorities are and what you would like to get from the service. Well, I'd like to get my hip better so I can stay at home and get back to doing the shopping and going to bingo, as well as visiting my sewing group.
Okay, great. Let's see what we can do for you. To start with, we'd like to have a look at your hip. If you're able to put weight on it, then it's probably not broken or dislocated, and it doesn't look as though it's out of place, but we would like to take an x-ray just to be sure. The Dr. George will do this, and he'll also have a chat with you about some of the things that you've been having difficulty with lately. Julie also mentioned that you might be having a bit of trouble remembering things since your fall, and haven't quite been yourself. We would like to do some checks to see if there are any underlying issues that may be causing these difficulties.
We would like to get you in to see a dentist about your gums. It's really important because of your diverticulosis that you are getting enough fruit and vegetables in your diet, which we realize is hard to do at the moment with your sore and swollen gums. The dentist will give us a better idea as to what is causing your discomfort. And as your audiologist, the doctor and I would like to check to see if your fall had anything to do with your balance. I will also check your hearing, and if you need hearing devices, I will refer you to your ear, nose and throat doctor to get a clearance for hearing devices. Because you are eligible for the voucher services of the Office of Hearing from Australian Government, the hearing devices will be free of charge with only a small maintenance fee per year. The voucher service will provide you with personalized hearing devices and regular appointments for adjustment and support. We hope once you can hear better, you will be able to attend bingo and your sewing group again with no problem chatting with your friends.
Your pharmacists, Yan and Lauren, would like to talk to you about giving you some medication to help you sleep better. You have two options in this case. We can either increase the amount of oxazepam that you are taking provided that you stop drinking alcohol at night, or we can slowly take you off the oxazepam before trying a different approach. We are aware that you are taking aspirin for your heart, but Yan and Lauren would like to take you off this medication until the bruising in your hip resolves. We can also pre-pack your medication in something called a Webster pack, so that it's easy to remember which medications to take at which times.
The occupational therapist Dale would like to give you some equipment in your home to make things a bit easier. We'll help you find an over-toilet frame for your toilet so it's not so hard to bend down and get back up. We'd also like to help you find a non-slip mat for your bathroom floor and a slide board for your bath to make it easier to get in and out. You should be able to hire these from a local pharmacy for a low cost. Depending on what funding we can get and how long you intend to stay in your house, we might start thinking about changing your stairs for ramps to make it a bit easier for you to keep doing things independently for as long as possible. We would like our dietitian Sue to have a chat with you about what you're eating and how we can improve your diet. Sue can link you with services like Meals on Wheels to get you the best service possible until you're back to full health.
Together, Luke the physiotherapist and myself, the exercise physiologist, will give you an exercise program that will help you get back on your feet and using your injured leg again. If your medical examination does not reveal any underlying injuries, we'll be able to provide you with an exercise program that will help you get you back to doing things independently. We'd both like to perform some simple tests to help us better understand what types of things you can do at the moment. That way, we'll be able to tailor a home-based exercise program that will return you to your full strength.
We would also like to talk to you about linking you with an aged care assessment team. This is a government healthcare team that works with you and your family to identify your needs and determine funding for home modifications and community supports for you. They will come to your house and see how you're going about doing things around the house and where you might need a bit of help. They will then give you some options about how you would like to proceed.
To achieve your best health, it's important that you stop smoking. We know how hard quitting can be, so we'll work together to reduce any factors that make you want to smoke and enhance those that help you resist the temptation. Once you've got back to your best, we'd like to do a driving assessment with you to make sure that you are safe to go back to driving by yourself. How does this all sound to you? Do you have any questions?